proves that certain specific nutrients, ingredients, or supplements can enhance, our skin, our joints, our hair, our nails. And there's a lot of great science that's come out recently with marine collagen tripeptides, rice ceramides, hyaluronic acid, and there's a new supplement called Dermaval. Well, we've taken all 4 of those and we've combined it in a supplement called Rejuvenate. 3 delicious flavors, chocolate, cherry vanilla, pink lemonade, and then we have it unflavored for those of you that want to just put it in your coffee in the morning. It's worth a try. I endorse it, obviously, 100%. If you don't like it, we'll give you money back. It's as simple as that. So check it out at Fortify.com.
Under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lange.
Good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. I've been hosting Ask the Doctor since April of 1993, folks. As of this point in time, it is the longest running syndicated live medical talk shows in the United States. So I'm tooting my horn a little bit there. But this is a live call-in show, and it's dedicated to you, the listener, the consumer. So like I said, no matter how simple or complicated the question is, we will try to answer it to the best of our abilities. When I say we, it's Dr. Susan Summerton, my co-host, and myself, Dr. Michael Lange. Good morning. Dr. Summerton is in the studio with me this morning. How the heck are you?
Good morning, Dr. Lange, and good morning to all our listeners out there. I'm happy to be here today. It's a nice sunny day, and we're happy to answer any questions that you have today. So give us a call.
And you look pleasantly full this morning.
I'm very full because you're kind enough. We had a homemade omelet by yourself there, which was very delicious. We had some asparagus in it, some onions, and a little bit of cheese, goat cheese.
Goat cheese.
And then really delicious, one of my favorite fruits, some pomegranate, fresh pomegranate seeds. They were delicious. A great way to start the day.
We had a lot of protein. You're hitting the gym a lot. You're working out, doing a lot of exercise. So you got to pound that protein. We preach that. We got to pound that protein. Most of the people listening do not get enough protein, do they? When we quiz our patients, we ask them, what'd you have for breakfast? What do they usually say? Cup toast. Bagels.
A lot of bagels, a lot of toast. Carbohydrate is basically sugar as it's registered in your system.
And cereal and hash browns and, more toast and jelly. And, they get this surge in their glycemic index. The blood sugar goes up. And then when they're at work, about 3-4 hours later, they feel really weird and really tired because their blood sugar, overproduced blood sugar, and now their blood sugar actually drops. And they become hypoglycemic. So if they ate a really high protein meal, their blood sugar wouldn't be jumping all around, would it?
Right. And they remain full longer, more productive at work, more mentally alert. And we do have a little secret coming up. If you haven't had enough sleep and you do want to be have less brain fog the next day or jet lag, we do have a little secret ingredient that you can use as well.
And we're going to talk about that in just a few minutes, aren't we?
We are.
All right. Phone lines are open. If you got a question, give us a call. And we're live, video streaming all over the world. So it's good morning, good afternoon, and good evening, just depending on what part of the planet you're actually watching us from. And the phone number to give us a call live is 813-282-8283. That is 813-282-8283. And we're live broadcasting coast to coast on the Ask the Doctor Network. So multiple radio stations throughout the great country. One more time, I'm going to give you the number. Write this down. Call anytime during the show. It's 813-282-8283. Also, if you want to learn a little bit more about what we have to offer from a nutritional standpoint, the Fortify Vitamin Company, I started years ago. I'm the lead investigator and the formulator. And of course, Dr. Summerton helps me with everything we do with that company. And it's an evidence-based, science-based, fully transparent supplement company. We tell you exactly what's in our supplements. I'm holding up our new Fortify Creatine, MyH&B Vitamin D. We tell you exactly how many milligrams. We tell you if there's anything else in this. So it's not something that has a proprietary blend. Our new organic blue-green superfood that we have, we tell you exactly what's in it. And you know, the superfood, we combine the fruits and vegetables both. So it's not something where you have to buy a reds formula or a greens formula or a blue formula. We put it all in one formulation. It's a powder. You mix it with water. And it's all certified organic, gluten-free, FODMAP-free. That means if you are prone with irritable bowel symptoms and things like that, digestive issues, you can take this. It's also paleo certified. Well, it's not paleo certified, but paleo friendly is the word I'm looking for. So if you're taking a greens formula or a reds formula, it's in a pill or it's in a powder, look at the label, read the ingredient profile, the nutritional profile, the supplement facts, if you will, and see what they say. If they say they got kale and broccoli and blueberries and strawberries, and they don't tell you how much of each, I personally may stay away from it because they may put 1 milligram of the expensive stuff and 99% of it is the inexpensive stuff. And most of that is coming, believe it or not, from China. None of the stuff that we put in our supplements comes from China. I do pride myself on that, and it makes our stuff sometimes a little bit more expensive. But check it out, the Fortify Organic Blue-Green Superfood at fortify.com. All right, we're going to go to the phones, Dr. Summerton, and let's see who's on hold. First caller is James in Sarasota. Good morning, James. Thanks for holding.
Good morning. I'm curious if you have gift certificates available.
I couldn't hear him.
Gift certificates available.
Oh, gift certificates. Good. I might need a hearing aid soon. Yes, we do have gift certificates available at the Lange Eye Institute. So you can go by there and they can hook you up, or maybe you can even call them and they can email you a gift certificate. That's pretty simple.
Fantastic. Thank you, doctor.
All right. Thanks for the call.
That's actually a great idea with the holidays coming up. We got to start thinking about what kind of gifts we should give people. And I know giving people the gift of health is something that everybody wants. So something to think about on your upcoming holiday list.
And I'm going to do a little plug for Wata Water. I'm holding it up right now. So the gang at Wata Water in Sarasota, this is the best water on the planet. And you can Google Wata Water and see why it's so good. I mean, it oxygenates you better than anything else. This water is like lightning hit it. It's amazing, the science behind this. So you can check it out. Rob in Sarasota, Rob Gordley, did a good job developing this. A lot of people are taking it. They get addicted to this stuff like crack. I'm telling you. So it's something in this water. It really energizes you, and there's a lot of science behind it. So it's called Wata Water. You can get it at the Lange Nutrition Center in Ocala, and you can get it at the Fortify Nutrition Center in Clearwater. We're going to open the phones again. If you got a question, give us a call, Dr. Susan Summerton, and myself, Dr. Lange, 813-282-8283. That's 813-282-8283. Remember, we do have gift certificates available at the Lange Eye Institute in the Villages, Florida. The Lange Eye Institute is on the corner of County Road 101 and 466, right in the middle of the Villages. We've been there for over 20 years. And I'm going to give you the phone number for the Lange Eye Institute. If you'd like to set up an appointment to see me, it is 352, or to see Dr. Summerton or Dr. Caputi. That's 352-753-4014. 352-753-4014. And I am the same Dr. Michael Lange that used to be in Gainesville, Ocala, Inverness, Tampa, Clearwater, Summerfield, Citrus Hills. Remember, we had 14 locations. They were called Lange Eye Care and Associates, and we sold them all in 2016 or 17 and kept the Lange Eye Institute. It was a good day. And you can see us in the Lange Eye Institute. It's just a hop, skip, and a jump from wherever you are. It's a pretty big facility. We got 2 big wings to it, state-of-the-art technology. Dr. Summerton is also a certified nutritional specialist, fellowship trained in many arenas in nutrition as well. So she will not only do an eye exam, she will review with you what's good for you, what foods are good, what foods are bad, what supplements to take. And that's all included in the eye exam. You don't have to see a nutritional specialist. So it's that added benefit at the Lange Eye Institute. Dr. Summerton, we talk a lot about dry eye on this program. And we don't talk enough about one of the culprits of dry eye, the leading cause of dry eye, contact lens intolerance, problem with the digital devices, eyelid inflammation. People get recurrent styes and hordeolums and things called chalazions, ocular surface disease, damage to the eye, recurring infections, and all of this can be something called Meibomian Gland Dysfunction, or MGD. You expand on our listeners and viewers what in the world Meibomian Gland Dysfunction is?
Right. Those Meibomian glands that you're talking about are right on our lower lid and our upper lid, layered there, that every time we blink, they're supposed to squeeze a little bit of meibum, which is oil, into your tear film. And that's one of the 3 layers of our tear film. And the oil is what stops your tear film evaporating. So when we're staring at the computer, when we're reading a book, we should have about 16 seconds before our tears start evaporating. We need even a little longer than that because our blink rate slows down on the screens. But if you don't have that nice coating of oil, then it's going to start evaporating, and you have that chronic cycle throughout the day. And your eyes, you blink, they evaporate. You blink, they evaporate. Your vision's going to get blurry. Your eyes are going to get red. Your eyes are going to get tired, and you're going to be uncomfortable. And we know many, many, many people out there have that. So we have to work on what can we do to improve those glands to give you better vision and just an overall better feeling throughout the day.
And so some of the things that people can do that are listening, obviously this does not replace a medical evaluation or an eye examination. But if you think you have Meibomian gland dysfunction and dry eyes, you can do hot compresses. You can do lid hygiene. So we clean your eyelids. And the one we like is Optace Tea Tree Oil lid wipes. And you can get those at Fortify.com, on the website at Fortify.com under eye care. But nutrition, we like to talk about nutrition for Meibomian glands. There's definite clinical evidence that a combination of reesterified triglyceride form omega-3, lutein, zeaxanthin, astaxanthin, black currant seed oil that has at least 140 milligrams of GLA, this combination, which, by the way, is called Fortify Advanced Dry Eye Therapy. If you go to the Fortify website, you can click on Advanced Dry Eye Therapy. We've combined all of that in a box, and it's pretty interesting because it works on 3 pro-inflammatory prostaglandins. So that's series 1, series 2, and series 3. And most of the people aren't going something that they take that actually helps quell all 3 inflammatory cascades. But that does. And one reason for that is the GLA that's in black currant seed oil helps stimulate series 1 prostaglandins. And unless you're eating borage oil, black currant seed oil, or evening primrose oil, that inflammatory cascade kind of goes untouched. So that's why we put all these together to help with inflammation. And inflammation is one of the root causes of Meibomian gland dysfunction. So we heat them, we clean them, and we nutrify them. And then we also prescribe oral antibiotics. Sometimes we'll prescribe doxycycline or a Z-Pak, a certain way that we prescribe the Z-Pak, usually 1 gram once a week for 3 weeks. So it's not like a Z-Pak that you're thinking of. And a lot of times that has less side effects than doxycycline. But we have to also determine, the patient's general health. Do they have an autoimmune disease? Do they have heart problems and things like that when we're prescribing these oral medications? So there's a lot of things that we can do. But something we're going to really hone in on today is a creepy little crawler on your eyelashes called a mite, a Demodex mite. And I tell you, a good portion of the population out there, especially after a certain age, are prone to develop Demodex mites, and that's something called Demodex blepharitis. And Demodex does crawl into your glands. It's a little varmint, and it's got little claws on it. It lays eggs in these glands all around your lid margins, and then it regurgitates also in your glands. So there's lots of nasty byproducts and bacteria clogging your meibomian glands. And all of you that have, chronic dry eye, lid erythema, swollen lids, fluctuation in vision, recurrent styes all over the lids, can't wear your contacts, crusty stuff all over your eyelashes, especially in the morning, you very well and quite probably have Demodex. And Dr. Summerton is an expert on Demodex. So I'm going to let her go into a little bit more detail about Demodex and a couple of ways that we can treat it that really work so you don't have to be miserable.
It is. And that's one of the things we're looking for when we do talk about dry eye, because that can be a root cause. All that inflammation from the mites, they live in the eyelash follicle, but right by the eyelash follicle are those meibomian glands. So they cause that inflammation, and they can affect the meibomian glands and live in the meibomian glands as well. It's a different breed of it. So it's pretty easy, actually, as us as eye doctors to diagnose. We can look at the base of the eyelashes and we can see what we call collarettes there. And we know right away that's what's causing it. So like we mentioned before, those tea tree wipes are a go-to. I personally use them daily just as preventative measures. I actually like them to use them at night to remove makeup. But I know that I'm doing that hygiene to prevent those Demodex, because it is very prevalent. A lot of people have it, but it's some just get an overproduction and it gets out of control and you get all those symptoms. There's a new prescription drop, relatively new. It's been about, I think, almost 2 years now, Xdemvy, and we can prescribe that. It's a little tough to get sometimes, but we've done our research on which pharmacies we can get it, because it can be expensive. It can be up to $2,000, but we found ways to help you with that. And it's going to be a drop twice a day for 6 weeks. And it works amazing alongside using those tea tree oil wipes. And it's just amazing when we can see the before and after. And then you as a patient can feel the difference. And we just know, again, we're stabilizing that tear film, getting rid of the Demodex, and making you and your eyes happier.
Killing those Demodex mites really helps the dry eye significantly. And it's very expensive now. But now we have a way where we have some philanthropic work and a special pharmacy that send you to, and literally we can get the price down to $0 or $30. So that's pretty good depending on your insurance. So if you think you might have Demodex mites, come on in to see Dr. Susan Summerton or myself or Dr. Lori Caputi at the Lange Eye Institute. We may prescribe that, but you can certainly go to the website at fortify.com or go any place online and buy the Opti tea tree oil lid wipes. And I usually recommend a hot compress first. Do this right before bed. Hot compress on your eyes, and then take the Opti lid wipes, tea tree oil lid wipes, scrub them really good. Leave it on when you go to bed, all right? And that helps kill those mites and the eggs when you're sleeping. But there's nothing better than that Xdemvy drop. It works quite well. And we want to eradicate the infestation. And you're not dirty. It doesn't mean it's not crabs, right? It's not lice. It doesn't mean you're dirty, right?
It definitely doesn't mean you're dirty. We do tend to see it more in the aging population, but we don't have a connection. Even in the third world countries where there is a lot more dirt, it's not more prevalent there. So we know it's not associated with that. It's just something to do with inflammation triggers and overproduction. And we didn't mention what also really helps is our IPL treatment, that intense pulse light. So when we're treating you for the dry eye, for the light treatment, that treatment where we need to do 4 treatments 2 weeks apart with the light therapy, that also kills the Demodex mites, and especially those ones that get down deep in the Meibomian glands. Those ones we can't see. We can only see around the follicle, and it really gets to them too. And so you have that level of comfort knowing we're helping the dry eye and killing those Demodex that can be deep in those glands.
And what the Lumenis OptiLight is what we have. Folks, Lumenis OptiLight is an IPL, the only IPL FDA approved for dry eye. It works amazingly well. I got to tell you, amazingly well. We have hundreds, if not thousands of patients we've done this on that have had chronic dry eyes, chronic Meibomian Gland Dysfunction causing the dry eye. This is a relatively quick procedure. It's painless. It's non-invasive. We do it in a special spa light setting at the Lange Eye Institute. We lay you back. The technicians put like a nice little gel, soothing gel all around your eyes. And we put little patches on your eyes or shields. And then this is light. It's like a pulse of light. And we pass over your eyes, your lower eyes and your Meibomian glands 4 passes. And then we do it again in 2 weeks. And we do it 4 times. So it's a 2-month treatment. It's not covered by insurance. So it is a pay out of pocket. But it works. It really does. So if you've got dry, sandy, gritty, burny eyes, recurring styes all over the eyes, you're just not satisfied. You got swollen eyelids and you've tried everything. You've done the lid scrubs. You've done the supplements. You've done the artificial tears. You've tried, Restasis and all the other prescription drops. You've had punctal plugs done and your eyes are still very irritated. Go to your local eye doctor, optometrist, or ophthalmologist, ask them about IPL, intense pulse light therapy, or certainly come to the Lange Eye Institute. We have the only OptiLight in the villages, Ocala, Gainesville. So we kind of have a monopoly on OptiLight IPL. And then we can add something called OptiLift. And OptiLift is an interesting type of treatment also that's non-surgical, and it helps to tone and tighten the paraorbital muscles. So all of you that have these little saggy eyelids, that's called lower lid laxity. Your lids are pulling away from the globe. Your eyes get extremely dry because of this. And the studies indicate OptiLift can reduce dry eye symptomology by close to 300%. I'm holding it up in front of you right now. You can see a picture of it if you're watching us live video streaming. That's the OptiLift. So not only does it have a functional improvement in dry eye, it has a little bit of an aesthetic improvement in your appearance. We all want to look a little younger as we mature. So what we use is something called proprietary dynamic muscle stimulation. It's like a mild electrical current combined with RF frequency, radio frequency, and it works quite well. We've got before and after pictures of people. And so ultimately the combination of the two, OptiLight, OptiLift, is very effective for those of you that have lower lid laxity and significant dry eye. And Dr. Summerton, we've been getting some great results when we combine the two.
We have, because of using that light therapy, we enhance those Meibomian glands function. And then when we use the OptiLift, it's tighten those lids. So when you do blink, you have to have a tight squeeze to that blink to squeeze that oil out. So we could fix those glands, but if your lids aren't touching and squeezing as you blink, it's not going to come out in the tear film. So they're additive. And I think, I don't know if you mentioned that little kind of potent power of the OptiLift also stimulates collagen production. So that's kind of where they had me there, that it definitely helps that cosmetic factor too, which is that added side benefit when you get it.
Right. And then kind of the triple whammy, if we really want to help reverse the aging or slow it down, and me being at 60 now, or a little over 60, I want to do this. So not only do I want to increase functional ability of my eyes, so I take the Fortify Rejuvenate. That's a powder that we developed, and that's a marine collagen tripeptide. It has German hyaluronic acid, rice ceramides, and Dermaval, which is 9 superfoods, a little biotin, liposomal vitamin C made in America, and a multivitamin mixture, all in 3 delicious flavors and unflavored. And what that does, it's clinically backed by a lot of good science. And the studies are on the website at fortify.com. So Fortify Rejuvenate after 12 weeks, it's all evidence-based ingredients with a lot of really good studies, can indeed help regenerate collagen and elastin, help minimize fine lines and wrinkles and crepey skin, amazing for the hair, skin, and nails. So think about that. And then on top of that, you can add on the outside something made by One Skin. And I wasn't a believer until Dr. Summerton started using it. And literally, she looks pretty good for 86, doesn't she? She's on the. So you know more about the One Skin. I mean, we used to have Obagi, we had SkinCeuticals, and nothing against those companies, but it seems like One Skin has put everything into their one formula. The peptides and the hyaluronic acid and all this other stuff. And it's great to rub around the eyes to help minimize these fine lines and wrinkles and help with the elasticity and just kind of tighten things up.
It is. And they've really packed the study behind it. We're always for non-toxic, non-chemical things that we can do and making sure that it's not got any contaminants in. But the One Skin is a peptide. They've found a unique peptide that fights skin aging. Peptides are really hot right now. You hear of the GLPs. Those are peptides. And so they're messengers. And so they've actually found a skin peptide that we can apply topically, and it can penetrate deep enough, because a lot of these cosmetic creams, unfortunately, even the expensive ones, don't even get into the dermis where we need it to have the effect. And this peptide actually stops what we call cellular senescence. And that's basically the cell growth. But when you have that, then you also pass the message of more inflammation, not only to those cells around it, so then you get cell death. But we want to encourage, with the proper peptide, the proper messenger, new growth of healthy cells so that we have that nice skin. And it's amazing. They actually did this peptide study with human skin. A lot of times you can't study human skin with these molecules, but we always, when you have lid surgery, upper lid surgery, they cut out all this extra skin. So we have all these extra skin samples they've used in the lab. And that's how they originally kind of tested it, is making sure it does penetrate through. And you are going to get what you pay for, because it does work. And you get those nice skin benefits without the toxins.
And One Skin has an eye cream. They have a face cream, and they got a body cream. And they also have an interlocking cream, which is very important. It's a good idea to get some sunshine for the vitamin D, and there's some health benefits from the sun, but you don't want to overdo it. So you're wearing an SPF long sleeve shirt if you're out in the sun all day long. A good UV blocking, type of sunscreen is a good idea. A hat and a good pair of sunglasses. And I said a good pair of sunglasses. Spend a little money, get a name brand sunglass. Don't skimp and buy a cheap sunglass. Sometimes it can do more harm than good. So the phone lines are open. If you got a question, give us a call. Dr. Susan Summerton of the Lange Eye Institute and Fortify Vitamins, and Dr. Michael Lange. We're here to answer those questions. Call us at 813-282-8283. That's 813-282-8283. Also, I have somebody here chiming in on Instagram, my personal Instagram, saying, Dr. Lange, I am a pescatarian. I think that's what it says here. Not 100% vegetarian or vegan. I would like to know what I can take to build muscle and strength, because I can't drink whey protein. So that's interesting. We've got something that would really be beneficial for you being a pescatarian. I had to think about that for a second. A pescatarian, if I think, what is a pescatarian, Dr.
Fish.
Summerton? Fish. This
They
person's
eat
a fish.
They eat fish.
Okay. So they eat a lot of fish. So they eat a lot of vegetables and a lot of fish. So we have something called the Fortify Strength and Vitality Bundle that would be perfect for you. No whey protein. So what we do in the Fortify Strength and Vitality Bundle, we bundle 3 things that work synergistically together. And Dr. Summerton's on it. I'm on it. Okay. We take our vegan super protein. I like the salted caramel mocha the best, but we got it in chocolate and vanilla. That's a vegan protein made exclusively here from Proteins in North America. And we add something called velocitol to double the amino acid power. The amino acids are actually, and the essential amino acids, many of them are actually higher than whey protein. And it doesn't cause digestive problems like some people can get with whey protein. Now we add Rejuvenate. Now, Rejuvenate, if you're a true vegan, you can't take it because it has marine collagen tripeptides. But if you're pescatarian, you can take it. And I just talked about Rejuvenate. It's for the skin, the hair, the nails, joints. So, and then finally, we add what we just developed recently, and I'm holding it up. It's the new Fortify Creatine, MyHMB, and vitamin D. So all three of those at a dramatic discount. It's called the Fortify Strength and Vitality Bundle. So if you're looking for an all-in-one daily nutrition solution to boost energy, support muscle tone, promote radiant skin, hair, joints, keep your joints healthy, basically encourage vivacious or vibrant aging, check it out. Fortify Strength and Vitality Bundle. You just mix all three, shake them up in water, and drink them down. I love it. I've done it. I think I'm building muscle since I've added this new creatine. How you doing with it?
I love it too. And right now, I really my favorite chews is salted caramel mocha because I like to have it in the morning. And I feel like that's just a great way to start the day, that kind of mocha flavor. And I add the creatine, my HMB, and I had a scoop of the collagen. And that's how I start most of my days. And it's delicious. You can mix it with whatever liquid you want. We even talked about you could mix it with yogurt. You could mix it with cottage cheese. Of course, the pescatarians can't, but I mix mine just with water, and I think it tastes delicious. And you get all the benefits. You're getting the protein, you're getting the creatine, and you're getting the collagen. So you're getting those requirements. So I think our pescatarian friend will really enjoy that.
So give it a try. Fortify Strength and Vitality Bundle at fortify.com. We spell Fortify as Fortifye. Fortifye. Fortify.com. And the phone number for Fortify Vitamins is 866-503-9746. That's 866-503-9746.
And we do have a question here on our stream. If our office does the glaucoma laser treatment, which right now she's probably referring to the YAG laser treatment. We don't offer that right now. We don't have a laser in our office, so we do refer that out. But there is many benefits. We do recommend it. The YAG laser treatment, called the SLT treatment, has been studied as a great first line of treatment for glaucoma. And basically, if you have high pressure in your eyes or you have any type of glaucoma, really, they want to improve the flow of the fluid from the front to the back of the eye to reduce that pressure. And the laser treatment goes along the little channels from the front to the back of your eye to open that up, and sort of a natural way to improve that flow and get that pressure better. It's pretty non-invasive. It is, but there's less chance of infection or anything like that versus surgery. And it is a great first line treatment, especially if you have trouble with drops from side effects or even just putting drops in. It's a great option. I tend to recommend that a lot, along with our eye pressure and nerve support formula for glaucoma. That activates and helps the ganglion cells. And the ganglion cells are what actually get damaged in glaucoma. So we want a way to protect those on the inside when either you're at risk or you have glaucoma.
And glaucoma, by the way, is the sneak thief of your sight. You have no symptoms until it's too late. And that's one reason you should go to your local optometrist, optometric physician, or ophthalmologist, if for any reason at all, is to have your pressure checked. And that's only one of the risk factors. There's a lot of other things that entail a diagnosis of glaucoma, because you can have elevated pressure and yet not have glaucoma. By the same token, you can have low pressure and have glaucoma. And there are other lasers. There's peripheral iridotomies that can do. If somebody has narrow angles, they actually zap a hole through your iris to create a passageway so you don't get an acute glaucoma, narrow angle glaucoma attack. But she was talking about the SLT, and there's still ALT, and there's a lot of other minimally invasive procedures available for glaucoma. And we're lucky and blessed to have a lot of glaucoma experts in the area. and throughout this great country, but especially in Florida. If you'd like to see us, we have a large glaucoma practice. We treat glaucoma medically and kind of holistically with a twist until you need surgery. And then you can come see us at the Lange Eye Institute. And the phone number for the Lange Eye Institute is 352-753-4014. That's 352-753-4014. And it's not simple to really make the diagnosis of glaucoma. There's a lot of things that come into play, and we have all of that technology. So we look at the shape of the optic nerve. We take a picture of the optic nerve. We do a special scan of the optic nerve called optical coherence tomography that analyzes the insulation surrounding the optic nerve called nerve fiber layer. And it goes a step further and looks at ganglion cells. And we can take it even a step further now because we have OCT angiography capability that actually analyzes the blood vessels that are feeding the optic nerve. Then we do functional tests. We do the visual field testing. We do electroretinograms, kind of like an EKG of your eye. We measure the angles digitally now. We measure the thickness of your corneas. So there's a lot of technology that comes into play to make the diagnosis of glaucoma. And the key really, Dr. Summerton, is early detection because these patients have absolutely no symptoms. I have patients that come in asymptomatic with 40 and 50 pressures and 0.9 cup to disc ratios, and they're just about getting ready to go blind. And the reason for that is they haven't seen a doctor in 10 years, an eye doctor, and they didn't know they had any symptoms. And people can go blind painlessly, right?
Right, because you don't feel it and you don't necessarily see it until it's too late. And that is one of the very difficult parts of glaucoma. We can prevent it from getting worse, but we can't cure it. And we can't bring that vision back if you have those blind spots in your side vision, because you could be walking around with 20/20 vision and not realize you're getting those blind spots off to the side. So we want to catch it early. We have many people that we follow annual that they're high risk for the glaucoma, but don't have it. But we want to intervene if they get it. And so we do have that great equipment you talked about to give us really great statistics, great numbers. So every time you come in, we can get those measurements and we look for change before the damage happens. And that is, like you said, the key is catching it before the damage happens.
And we also have to be very cognizant of their systemic health problems. Do they have asthma? Do they have congestive heart failure? These medications that are topical, they're drops, but they get systemic absorption and can cause potential problems. And believe it or not, a glaucoma drop can, in the wrong hands, cause serious health problems. You can stop breathing when you're sleeping at night. So we got to double dot the I's and cross the T's, so to speak. A thorough case history is very important. And then obviously if people have symptoms, we have to stop their medications and maybe try something else. So the gist of this story is if you haven't seen your local optometric physician, optometrist, or ophthalmologist recently, set up an appointment if for any reason at all to have your pressure checked. And that's only a screening. And remember, screenings can be very misleading. A lot of you are going and having a screening, just a visual acuity at your pediatrician's office or your primary care office. And then you go to the local Lions Club or the health fair where they're puffing some air in your eye and they say your pressure's normal. That can be very misleading because you can have normal pressure and yet you can still have glaucoma. So this does not replace a comprehensive eye evaluation. All right, phone lines are open. Give us a call. 813-282-8283. That's 813-282-8283. As a matter of fact, I think we're getting ready to take a break here in just a second, but give us a call right after the break. It's 813-282-8283. Dr. Summerton and myself will be right back.
There's nothing more frustrating and irritating than chronic dry eye. It never stops. The itching, the scratching feeling, the fatigue and weariness. If you're suffering from chronic dry eye, go to Fortify.com and join thousands who've discovered Fortify Advanced Dry Eye Therapy, a combination of Fortify Super Omega, Fortify Focus, and Fortify Black Currant Oil GLA. Fortify Advanced Dry Eye Therapy works to address oxidation and inflammation in the eye and the entire body. This combination, once only available to patients in the doctor's office, has now become available to you. And already, countless numbers of listeners have found relief with Fortify Advanced Dry Eye Therapy. If you or someone you care about struggles with dry, itchy, exhausted eyes, order Fortify Advanced Dry Eye Therapy today at Fortify.com. That's FORTIFEYE.com, or call 866-503-9746. That's 866-503-9746 and at Fortify.com.
While others are hitting happy hour, you're hitting the gym. While they're hoisting mugs, you're lifting kettlebells. You owe it to yourself to get the most out of your fitness regimen before and after your workout with Fortify Fit. Fortify Fit's power-packed formula is designed to enhance muscle synthesis, strength, and endurance. All evidence-based nutrients in this proprietary formula are well documented and backed in good clinical studies. Taken before and after your workout, Fortify Fit is also hailed for what it doesn't contain. No dyes, artificial flavors, or carrageenan. With Fortify Fit, you get all you need to get the most out of your workout without needless additives and sketchy sweeteners. Order Fortify Fit today at Fortify.com. That's FORTIFEYE.com, or call 866-503-9746. That's 866-503-9746. 866-503-9746. And at Fortify.com.
Okay, good morning and welcome back to Ask the Doctor. I'm Dr. Michael Lange and my co-host, Dr. Susan Summerton, here each and every Saturday morning live. So if you got a question, give us a call at 813-282-8283. No matter how simple or complicated your question is, as long as it's vision-oriented or nutrition-oriented. Any other question, we'll try to answer it to the best of our ability. 813-282-8283. Remember to go to the website, Fortify.com, to look at the supplements we talk about. You can go to my personal website, drmichaellang.com, drmichaellang.com, and go to the top of the page, and there's the new Lange Wellness and Longevity Plan. So what I tell you is what foods to eat, what foods to avoid. I tell you what foods don't work well together, all right? We also talk about exercise, hydration. We talk about supplements. We talk about sleep. So it's free. It's the Lange Wellness and Longevity Plan. Go to drmichaellang.com. At the top of the page, there's an icon, Lange Wellness and Longevity Plan. It's also on the Fortify website. You got to go to one of the icons, and indirectly you can get to it as well. So phone lines are open, 1-813-282-8283, 813-282-8283. We're getting ready to talk about that one special ingredient that Susan talked about, Dr. Summerton talked about in a minute, one ingredient that has amazing benefits at any age. Now, we talk about fish oil all the time. It's not omega-3 fish oil, though that is important. And we're going to talk about that in a minute. But first, we're going to go see RJ in Citrus Springs. Good morning, RJ.
Good morning, Dr. Lange. I have a brother with early stages of dementia, and I think a couple of weeks ago you mentioned that your mom was showing signs of dementia, and you gave her. I don't know what you gave her, but I can't remember. I was wondering if you could tell me about it.
Absolutely. So my mom is knocking on 98 right now, and I got to tell you, she's doing amazing. She's watching the video right now. So, hey, Mom. So she had full-blown dementia when I brought her and my dad to live with us when they were 90. So that was 7-8 years ago, right? I mean, she would sit down at the breakfast room table and ask me, is Captain Steubing coming to the table? She thinks she's on the Love Boat, And
Right.
she really full-blown dementia, didn't know, where she was, what day it was or anything. And so I've had her on the diet and Fortify supplements all along, but it wasn't until we developed Fortify Focus and Brain, okay? Now, she was taking Fortify Focus, but when I put her on Fortify Focus and Brain, I realized that her memory was amazing, and it took about 3 months. And how I realized this, I told Mom, I said, look, Mom, we're going to go to the beach. So I have a place on Clearwater Beach, and it's not that far away. It's about a 20-minute drive from the bay. And I said, Mom, why don't you go get a little overnight bag and go meet me, in the driveway? And I was going to go upstairs and pack something. I figured, she'd be in bed sleeping or sitting on the toilet, something like that. And I got down, I went into her bedroom, and she wasn't there. And I looked out, and she was standing by the car with a little bag packed. So I got out there. We got in the car, and I said, Mom, where are we going? She said, well, we're going to your beach place. 10 minutes later, I said, Mom, where are we going? She said, Michael, you just asked me that. We're going to your beach place. Third time I asked her, when we're going over to Clearwater Beach, I said, where are we? She said, for heaven's sakes, for the third time, we're at your beach place. Don't ask me again. Now, if I would have done that 3 months earlier, before she was on the Fortify Focus and Brain, she would have said, we're going to Montgomery, Alabama to visit my mommy, or we're going to the doctor, we're going to the beauty parlor. She would have been clueless. So it did work, and it worked well. And I'm seeing that with a lot of my patients. I can't say it's a cure or treatment, but anecdotally with my mom, one Fortify Focus Brain a day really has helped her dramatically. Now, was it just time to get better? I don't know. I have a direct correlation with it. And if you look at the science, if you go to the website at fortify.com and look at the studies on cognizine, that's a patented trademark form of acetylcholine, and it has got some really amazing science for people with dementia and even Parkinson's as well. So something to think about. I don't think there's any negative side effects. It can't hurt you. Will it get the results you want? Until you try it, you won't know, right?
Right. But the cognizine, is that part of your Fortify Focus and Brain?
Right. It's in there, cognizine. Okay. And it's won a lot of awards as being an amazing nutrient. So yeah, cognizine. And you can Google cognizine and see what they say about it. But it is in Fortify Focus and Brain. And remember, the Focus and Brain also has the lutein, the zeaxanthin isomers, and the astaxanthin. All three of those cross the blood-retinal barrier and the blood-brain barrier, and they have been shown to help with cognitive decline and help with oxidative stress and inflammation in the brain. So it's kind of a quadruple whammy, not only helping the retina, but helping the brain as well.
Oh, that's terrific. I appreciate it, Doctor.
All right, RJ, you take care.
Bye.
All right, you're listening to Ask the Doctors. It is November 1st, 2025. So now you know it's not a tape. Give us a call. Dr. Summerton's biting at the bit. So give us a call. It's 813-282-8283. That's 813-282-8283. So in the beginning, Dr. Summerton teased you a little bit and said there's a special ingredient that's good for all of us at any age with some amazing health benefits. Everybody's wondering what it is. And a lot of people are guessing what it is, but what is it?
Well, we were actually talking too about what happens if you're sleep deprived and you're a little brain fog, or you have a little jet lag from a trip. I think Dr. Lange knows well about that sleep deprivation. We encourage everybody to get a good night's sleep, 6 to 8 hours a night. But we know life happens and things get in the way, and you don't, but you still need to function that next day. So what we've been talking about all along, an ingredient that we always mention about fitness and health, but it's actually creatine. And creatine monohydrate specifically, it actually improves energy function. And so part of the problem, if you're sleep deprived, no matter what age, you're not producing enough ATP. That's what creates the energy. So the creatine can actually help that. And for the ladies out there, it's actually a little bit more important for us because we don't store as much creatine as men do. We only store about 70, 80% of what they do. So it's actually even more important for us to get it from our diet, which you can get it from meat, but using a scoop of the creatine, because again, we're trying to get all that meat in our diet, all the protein. The extra scoop can give you that boost after you haven't had as much sleep, but it also helps. Our last caller talked about dementia, and we talked about the acetylcholine and in the focus and brain to help that. There has also been some studies on the creatine and Alzheimer's and dementia, again, because it helps that ATP, that energy of that brain. So it's a pretty well-studied, very safe supplement to take. And most of the time it's powder form. And so it's not even you just mix it with water and very easy to get down.
Excellent. So Creapure creatine is what you want. It's the only non-Chinese developed creatine. It's made in Germany. Remember, it increases power and strength and muscle growth. It fights against Parkinson's, dementia, and sarcopenia. That's muscle wasting. It improves brain function, protects the brain against trauma. So all of you athletes should be using it. Also, studies have shown it can reduce blood sugar and help with fatigue. So our new Creapure Creatine HMB vitamin D is the triple whammy of anti-aging. We're getting ready to take another call here real quick, but I want to mention you can get the new Blue Light Shield and Blue Light Defense at the Lange Eye Institute right now. We are an exclusive on it. You can't get it anywhere else unless a doctor buys it from us. I've trademarked those names. So it's Blue Light Defense and Blue Light Shield. These are blue filtering lenses. They block specifically 420 nanometers. The Dr. Funk study showed that 411 nanometers of blue light is most damaging to your retina. We're one of the only ones that blocks that exclusively, and we let the beneficial blue light through. So think about that, Blue Light Defense or Blue Light Shield at the Lange Eye Institute. Also, we have a new driving lens that's pretty amazing. It actually increases contrast at night, has super wide channel, so it doesn't interfere with you in a progressive lens, a new driving glass. All right, we're going to talk to Jacqueline really quick. Jacqueline, good morning. We're going to have to talk fast.
Yes, Doctor, the only thing I want to know right now, I understand that you're located in Sarasota, which I never knew before. Would you have the exact address in Sarasota?
No, we're not in Sarasota. We used to be in New Tampa, not in Sarasota. The sole institute is the Lange Eye Institute in the Villages, Florida. It's about an hour driving fast and about an hour and a half driving normal.
Okay. All right, Doctor. Thank you so very much.
All right. Thank you.
I really appreciate it.
Bye-bye.
I used to live in Ocala, so I know that you're in the Villages.
Right.
Right now I'm in Sarasota.
Come see us. Bye-bye, Jacqueline.
Thank you. Good.
All right. I want to thank everybody for tuning in and listening to Ask the Doctor. We've got 13 seconds to say goodbye.
Wishing everybody a healthy day, a little bit of cooler temperatures around here. Go outside, take a walk, just go enjoy yourself and move.
All right. See ya.